So hi friends, today we are just going to show you a basic video about ovarian stimulation. The main idea for today's video is that I am going to teach you about how to do a follicular study. So here this is a patient that we are studying today. Today is almost the 10th or 11th day of stimulation. So this is a pure gonadotropin superovulation cycle, which some people call controlled ovarian hyperstimulation. The aim for every patient should be predefined on the first day itself. So this was a case which we are taking ahead for OPU, that is oocyte retrieval. So as you can see, it's a case for IVF. So over here you can see this is the endometrial lining that we are going to show. So there are always two parts in every fertility scan. One is the uterine part and one is the ovary or the follicular part. So first, whenever we insert the vaginal probe, this is what most machines show you. So what you have to do is you have to optimize. Whenever we optimize, the basic idea is it should look like a passport photo. That means less of background and more of those things that you are going to study. So you have seen I have changed the depth setting for this machine. This machine is pre-optimized for my choices. And let us study the uterus. The uterus is retroverted over here, as you can make out, and this is the lining of the uterus. Okay, the lining is very beautiful looking. It's a triple line endometrium, but now it has become a little hazy. This is what you typically see when the estrogen levels are a little supraphysiological. So this sort of a hazy endometrium is mostly seen where you can see that there is triple line, but not a very good looking triple line. This is the center line, this is the upper line, and this is the lower line. But however, this is a little bit hazy, and the reason it is a little bit hazy is because of the supraphysiological estrogen, as I told you. So you are supposed to freeze the image over here, and then you are supposed to take your cursor and take the maximum size that you can see. As you can see over here, you can see that it is roughly around 11 to 12 millimeters in size. Anyways, I usually do a freeze-all cycle, so the endometrium is not any of my concern, but this is just to teach you. Then you have to put on the Doppler window. The main part in the Doppler window is that your PRF over here should be 0.5 or 0.3. You have to change it using the scale button in most GE machines. And over here you can see that there is a very good flow. The blood supply comes from outside and penetrates inside towards the endometrium. A rough idea for you to understand is if it is crossing the outer line over here, that means the endometrial blood flow is quite good. I'm just simplifying over here. You can go through the books and read more in detail, but this is just for the person who has just started doing the ultrasound and wanting to know how it is. Here we have two ovaries. This is the right ovary, and over here you can see the left ovary in beautiful presentation right here. So let us go into the details of how to do a folliculometry. So now over here there are so many follicles. Which one would you like to study? Of course, it is always the biggest follicles that you have to study, and the second thing is you have to also look into the shape of the follicles. See, you can make out that this is a little bit triangular shape, so it's a little bit difficult to get the dimensions. We'll go after this guy. This fellow is a little bit big in size and it's a little bit round to ovoid. So this fellow is, even this one is going to give us a very good dimension. So what we do, just like the ideology of the idea and the funda of passport size photos, we take it, make it maximum size on the screen. You can either use the zoom button, but I prefer to use the depth button. Okay, over here we can make it go anywhere on the screen. So make sure it is in the center of the screen. When it's at the center of the screen, split the screen in two. You can do this by using the split screen button, and this is the follicle that we are planning to measure. Take your cursor. Now since this is a ovoid, I don't like to take from this side to this side. I do a bad measurement here. Okay, one side to side, one up to down, and another side to side. So now we go and see what's the measurement here. As you can see, 19, 13, 18. This you have to just roughly make an average of this, and this is almost close to a mature follicle. Now let's go to live imaging again. The other follicle, let us measure. This is again the same ovary. Split the screen half and turn and take a 90-degree cut. Okay, so again side to side, again side to side, and down to up. Okay, so you have done this with a nice zoom in, and again let us look at the figures over here. You can see it is roughly 19, 14, 16. So roughly very close to maturity that we are seeing. Now let us see the other ovary. This is the other ovary. This is the follicle that I am selecting. Again, take it in the center of the screen, split the screen, and this is what we go for. Again the same thing, side to side, down to up, and another second side to side. Okay, again if you go and make out over here, you can see it is 14, 15, 19, close to maturity but not yet fully done. Okay, so then we go to the Doppler assessment. Again, the most important part over here is the PRF, which you can see over here. It has to be 0.3, and over here we are seeing we have to be very steady. I like to rest my elbow when we are doing this so that I do not create movement artifacts. We can see that the Doppler pickup is almost wherever we show the Doppler window, it is there. So we can see that this stimulation is very good, and our chances of getting a good oocyte from this particular follicle is quite good. Then again, wherever possible, you can do a power Doppler study as well. This is something which is very easy for you to do. Always remember the mountain has to be more than 10. Okay, so as I told you, this is close to maturity but not fully mature. When it is fully mature, you will find out that it crosses that value of the mountains reach taller than size 10. So over here when you go to see, this is taller than size 10. This is very good. And again let us show you more. You can see that most of the follicles are very well stimulated. Again let us see more mountains. Here you can see again it is crossing the 10 mark. So hopefully this patient is going to give us a good yield of M2 oocytes. M2 oocytes means mature oocyte, which is going to give us a good quality blast. I hope this video was helpful to you. In case there are any comments, do ask in the comment section. Do like and subscribe so that YouTube understands that this is a good video that needs to be promoted. Thank you so much.